So I've jotted some notes down actually as we've gone through this morning, because you can't talk about a lot of the topics we've discussed this morning without talking about workforce, right? It's a key in everything. So I've been jotting some notes down. I'm going to try to make some tie-ins for you. Rear Admiral Ricks did talk a little bit about rural and workforce in his presentation, which was great. So we'll try to tie that in. And I had a spark in my brain as Sean was speaking as well. So some objectives for today: we're going to break down the current landscape of Pennsylvania's workforce, discuss some projected supply-demand issues with that workforce, and then discuss some impact of the current trends on workforce planning. So where we kind of start all of this and where workforce really ties into the work that we're doing, as you all know, we have an oral health plan that spans 10 years and 2020 to 2030. There are three core components to that oral health plan, workforce being one of them. As part of that, PCOH worked with the ADA's Health Policy Institute, and they contracted with the Health Policy Institute to really do an analysis of workforce in Pennsylvania, to break that down, to see where the supply and demand for dentists are, to see where there might be access to care challenges, and that is going to be used as we work through this oral health plan to really start to come up with a game plan as to how to address workforce. Like Helen said, there's a lot of rural workforce challenges, so I'm going to mention rural a fair amount through this presentation, but that's the space that we work within in our office, so that's kind of the near and dear to our hearts. The other challenge of workforce is it's a very, very large topic, and we have 15 minutes. So again, I'm not going to be that person today, but a little bit more about this HPI report. So the report was released in July of 2021. It is available online. You can read the full report. And actually, I think the webinar, so HPI did a webinar on the report as it was released as well, which was very informative. So if you haven't had a chance to dig into it yet, I would encourage you to jump online, take some time and read through it. The graphics, the visuals, I think were really well done, and I like that piece. So I've incorporated a few, but definitely take a chance and dig in a little bit deeper. So three areas of focus that HPI sort of dug into deeper for us. The workflow model of dentists, so predicted supply and demand. They also went historic a little bit as well and gave us a little bit of historic information on where were we, where are we, and then where are we projected to go in the future. Inflow and outflow, so who's graduating and maybe moving into the state or staying in the state, who's retiring, how did COVID affect that, right? So this report was being developed in the midst of COVID, and so we would have been remiss to not talk a little bit about that potential impact as well. And then very interesting to me, a survey of PA Medicaid beneficiaries. And so HPI did a survey of those with Medicaid insurance and sort of gauged their perspective as well, to really get that voice from the people and where those challenges in accessing care may lie. So those were sort of the three big pieces of the report. A little bit about the findings. The supply of dentists in Pennsylvania is projected to decrease on a per capita basis. You've seen a lot of these per capita numbers in presentations already this morning. I know that very first keynote presentation mentioned per capita numbers as well. So we like to look at supply of dentists as a ratio a lot of times. And we do that through that HRSA-HPSA data, which again you heard in that first presentation this morning. So those areas that are underserved by dental providers, HRSA usually uses this like 1 to 5,000 number. A lot of times when we're looking at larger data, it's a number to 100,000. So we look at populations by 100,000. How many dentists to serve 100,000 people? So that number is projected to decrease and then eventually stabilize around 2040. Pennsylvania is expected to gain slightly more dentists than they are to lose dentists. So we may have more dentists coming into the state or graduating than we have retiring or moving out of the state. However, our population is projected to continue to increase. So when you weigh that against itself, we now have more people, and actually our rate of dentists goes down. So it's not only how many dentists do we have, but how many people do we have to serve in the state. Also, a finding was the female share of the workforce is increasing, which is great. However, we know that there are work-life balance challenges within that. So when we look at full-time equivalents, or how many hours are these dentists working per week, our actual hours of service may go down because of that statistic. So some of the fun graphics. I love these visuals. I think they do a really nice job. If we look at that green line, that head count of how many dentists do we actually have in the state per 100,000 residents, right? So we've got our 50, 55 per 100,000 people. So that's pure head count. That's not talking FTEs, how many hours are they working. We could have a dentist working 1 hour a week and they're in that head count. We go down to FTE per year, so full-time equivalent, how many of those hours are they working, and then visits per week. And those numbers are pretty well in line with each other, but you can see based on that head count, they're significantly lower, right? That's where the part-time hours sort of come into play and influence that workforce. So we were doing pretty well, 60, 55-ish, right, per 100,000, not too bad. That has started to decrease. And you can see the numbers sort of decreasing, and then we sort of start to stabilize a little bit. 2040, we may see a slight increase based on the HPI predictions. So again, rural, right? The number of dentists per capita is higher in urban counties than rural counties. There's more residents in urban counties than rural counties. Along with that, there's more dentists. When we look at rural numbers specifically, we know a lot of the dentists that are practicing in rural areas are 55 or older. That means that they're probably going to want to retire someday. And when they do, we're not having as many dentists move into those rural areas. All of our dental schools in Pennsylvania are in urban areas. You spend a couple of years in an urban area, unless you have something bringing you back to that rural area, you're probably not going to go. Maybe we'd like you to go, but we've not seen that inflow of dentists to rural areas as much as we see dentists staying in urban areas. Again, moving forward, we're going to see that as a challenge as these dentists retire, and we're not able to move dentists into rural areas as frequently. The other thing that I sort of made in my notes this morning as Sean was speaking is the burnout factor of dentists, right? So if you are a rural dentist serving a huge geographic area, and one of it was actually a medical colleague, but somebody had once said to me, you either want me to click or you want me to care, and I can't do both. I can't start seeing patients at 8 a.m., stop seeing them at 6 p.m., provide that care all day, and then go home and do that back-end work of click, 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 so we get paid. What do you want me to do? And so there is that burnout factor as well. And sometimes that one dentist in that rural county is that one dentist in that rural county. That's a big job. That's a tall order, right? So the burnout factor there is large. It's significant. So some more fun data. So there's a couple of different acronyms on here. We've heard these a couple of times today, but just for those that may not be as familiar. Top line, we have our rural counties. So pink is 2010. The blue color is 2020. We've lost a significant number of dentists per capita in rural counties in Pennsylvania. Like 7 dentists per 100,000 people gone. When we look at urban counties, we have seen a decrease, but not as significant, and they had higher numbers to begin with. When we break it down to DHPSAs, which again we heard in the first presentation this morning, those dental health professional shortage areas, and I know the comment in the first presentation this morning was, urban's looking pretty good, not too many DHPSAs happening, rural areas are pretty much all a DHPSA, and that is a pretty accurate reflection. The rural counties do tend to be designated as full county dental health professional shortage areas. So we lost dentists in those areas as well. That makes sense, right? Because we know that those rural counties tend to be the dental health professional shortage areas. Again, similar losses in those non-DHPSAs, but not quite as significant. And then overall as a state, we had some losses as well with our overall dentists per population. When we look at the United States as a whole, again, some similar losses. A lot of the numbers really do tend to align with each other, right? We see some very similar trends, and that ties into that first presentation this morning where we were told that, Pennsylvania is kind of rated on tabs with that national average. So those were some neat findings of the report. So here's the Medicaid survey, which I think is super interesting. So Medicaid beneficiaries were asked some questions that were then included in this report. Both adult beneficiaries and children. So the parents were asked about their kids' oral health and the benefits that their kids are receiving under Medicaid. We know that children are really receiving preventative care. We've got that pretty well down. Still have work to do. I know there's a lot of people in the room that are still working on that, but we're doing a pretty good job. We're seeing an increase of kids accessing preventive services, really both rural and urban, so we're making some headway there, which is great. And the report reflected that. Primary reason that a child goes to the dentist as a Medicaid beneficiary is for a checkup. That's also a really great number, right? We don't really want you going because you have a toothache. We'd rather see you on a preventive basis. And so we're seeing that is happening for the children in Pennsylvania. Adults are a little bit of a different story. They are tending to access care when they have a toothache. So it's sort of when that need arises, then it's a more urgent visit. We know that's usually a more costly visit as well, and that's when adults are saying, okay, I have to call the dentist. One of the most surprising things that was cited in the report, we hear a lot about that access to care. It seems like we've done a pretty good job enrolling adults in Medicaid. They were aware, a lot of the adults in the survey were aware that there were dental benefits under their Medicaid coverage. Cost was cited as the biggest deterring factor. So I think there's a couple of reasons potentially for this. Basically, the ADA, their Health Policy Institute, in their analysis said things aren't working as intended. If this is the response, we're missing something. It could be pure cost. But I like to think, and Sean had mentioned this as well, it's probably hours off of work making that time. So it's not just the cost of care, but it's that backstory that is the true cost of care, right? So now I've lost work hours. So not only did that visit cost me X amount of dollars, but I lost X amount of dollars because I had to take off work. So I think that's a compounding factor. But I think that we were all a little bit surprised to see cost was cited as the reason that adults were unable or that it was challenging for them to access that dental care. So the coverage is there, but we're still missing a piece of that. Something's not quite working as intended. So at the end of the report, HPI came up with some recommendations for us. And I think that, we're doing a pretty good job as a state working on some of these pieces already. But as we look to go back to that, 2020 to 2030 oral health plan, we have work to do. We know workforce is one of those areas where we have work to do. This is the recommendation of the ADA. I'd love to hear, I'm hoping this is where we get you all using some Postit notes in the room and leaving us some notes behind, because this is what ADA is telling us might help. I think in some ways we've done this already, right? We have done some dental school recruitment. We've tried to promote some recruitment from rural areas in hope that once these students graduate, they're able to go back to their rural areas and serve their rural areas. There's some scholarship programs, there's some loan forgiveness programs, and so we've tried to move the needle there, but what more might we be able to do to really help dentists return to their homes and practice after graduation? We know that programs need to be intentionally designed, and I do think that we're doing a pretty good job of that, but we may still be missing something, right? We still need some more dentists to be moving back in as we're thinking forward. And then infrastructure and capacity. So we need to really think about workforce as a component of our public health infrastructure and dental workforce specifically. There may be some ways that we can have some help from our friends and our colleagues, right, as part of that public health infrastructure, but what more might we need to do? And then, again, the adult Medicaid benefits. Perhaps there's some work to be done on that front so that we're not citing cost as the challenge in accessing care. So what more might we be able to do? Again, there's an awareness of the system that's in place, but how do we make that work better for those beneficiaries? So again, I'm hoping you guys will grab your Post-it notes and start jotting us some notes if you have ideas with how can we help? How can we build this workforce? How can we maybe make sure that what's projected through 2040 isn't actually the case? And I think we have a good 15 or so years, right, to be able to work on that. So hopefully, if we're able to make change, we're able to really outsmart these numbers a little bit. So I'm not going to stand between you and heading out. If you'd like to continue the conversation with me, I'm happy to talk rural and numbers and workforce and all of those fun things any point in time. So I'll let you guys have your conversations at the table. Again, feel free to reach out. Thanks for sticking around. I appreciate it. And let me know if you have any questions.